Alabama Vascular and Vein Center, Petro Cosmetic Surgery, and Tivoli Med Spa are all in Vestavia Hills. We're in the Vestavia City Center.
It's just a great location for anybody in the whole city of Birmingham, and patients like it a lot.
We're based in Vestavia Hills, but we also see patients in Coleman, Prattville, Atlanta, Oxford, and Tuscaloosa.
We have developed a vein center in Tuscaloosa that's state-of-the-art. I mean, it's really, really nice. And then a vein center in Prattville outside of Montgomery.
I know the patients truly appreciate us coming to their towns and seeing them.
There aren't a lot of doctors who do what Dr. Petro and I do, and to make it available to them in their location, they tell us is a real plus, and they appreciate it very much.
Dr. Kingsley is a vascular surgeon who's board certified in phlebology, and vein work is really his passion.
More and more patients wanted some kind of cosmetic treatments, whether it's just injectables or Botox. In this practice, we've got somebody who knows a lot about blood vessel work and has spent a career in it, and somebody who knows a lot about the cosmetic work and how to turn a bad situation into a good one and then make it look good at the same time. So the two practices really blend. They almost blend automatically.
We have the latest technology. We have millions of dollars invested in lasers.
The cosmetic practice and the vein practice all are very modern.
We insist on having the best technology that there is for the procedures that we do, from the vein work to cellulite treatment to liposuction to any type of laser resurfacing and skincare products.
And now we use ultrasound to map out we can map out details of the circulation with just an ultrasound machine.
Everything's designed for the patient's comfort. Dr. Kingsley even lines the operating room tables with Tempur-Pedic mattresses so that people will be very comfortable.
And there's no reason we shouldn't use the best in the world, period. And so we can and we do.
I mean, if you want the latest and greatest, the tried and true, if you want the treatments that have been tested all over the world, and you want the very best treatment with the most up-to-date technology that there is, it's Alabama Vascular and Vein.
I think patients do recognize that when they come here, they're going to get really as fine as care as you can get anywhere in the world. My background was in primarily blood vessel surgery, which included vein problems, but most vascular surgeons do arterial work. In the late 90s and around the year 2000s, this new technology became apparent. I wanted to help evolve this technology, and I did help invent some of the techniques of it along the way. So I did some of this at Caraway and Health South Hospital. I was still doing artery work, and I did lung cancer work. But the vein practice was people were calling and calling and calling, and there was a time when my nurse called and said, you're going to have to do something about your vein patients. You've got a 6-month wait list. At that point, about 2005, I decided I would just focus entirely on vein disorders, and that's how a lot of this has transpired. I helped evolve some of the vein work, and I wrote quite a lot about it. And then I got asked to go to Japan and speak to this international society about the stuff I had worked on and helped develop. The Australians were there, and they heard me talk, and then next thing I know, they say, would you come, we have a big vein society in Australia, would you come speak to that about your work? And I go almost every year and I give them an update on the work we've done, and I did evolve some new things that seemed a little heretical, but they turned out to be accurate, about how to treat some complex problems. Some patients have had blood clots in their deep veins, and they still have serious issues, and it turns out their superficial veins are bad too. And I figured out that there was a way to treat them that would cure their problem, and most people wouldn't touch them. The guys who invented modern sclerotherapy for spider veins are from Italy, you know, and they'll be in Australia almost every time I go, and they have a speaker's dinner, and I'll just go sit next to them because I want to find, and I'll say, Tilio Cavezzi is one of them, and I'll say, Tilio, what's the latest? What have you done this year, you know? And he'll always tell me. And then there will be a banquet that night, and I'll talk to Dr. Ramelet from France, who had helped invent some of the little microflebectomy So I get to learn from these famous people. We take abnormal vein circulation and we manipulate the pathology of it to the point that the vein circulation becomes normal.
He was president of the Alabama Vascular Society, and that's a group of people in Alabama throughout the state that are focused on vascular disease. To be a specialist in vein disorders, or phibology is what we call it, you can't really do it without understanding the other things, because there are arteries and all kinds of other things that are involved in leg pain and suffering. So to be able to look at it from the point of view where you understand the majority of other things that could be wrong keeps you from just seeing one thing when you look at a patient or look at a leg. So I think that really adds to his ability to teach and also to be just a true expert and a true pioneer. He looks at everything and he looks at the whole patient.
Every patient I work on, I take them to the car myself. Then I know when I put them in the car, they're fine, and I'm talking to their family, and I can explain everything I did, and I can tell them how to take care of their loved one. You know, we're here to take care of people and to make them better, and we find a niche that pleases us, that really that we're very good at, and that's our reason to be. Patients are smart. They shop the internet more. About half of my patients come because their family or a friend told them that I had done this initial work in the development of modern vein treatment, and I have quite a lot of experience in it now. The truth of the matter, more than almost anybody in the U.S., because I started it early. And then I helped develop some of it along the way. And if they live on the internet, they'll look at the credentials and they'll see some of that. If you're going to come to me for care and I'm going to treat you, I don't have any doubt in my mind that you're going to get the best there is. So my reward is knowing that first they're going to get better, and second, they're for sure going to get the best care that possibly can be given anybody.
I've always been very artistic. I've always enjoyed really beautiful things. I've always been able to look at something and see what I wish it was or what I felt like it should be. My dad's a surgeon, and I worked with him and found myself more interested in how he closed the skin than the many parts of the operation. And that was the part I enjoyed because that was the part people saw. It was probably the easiest decision of my life to be a surgeon. I grew up in Jackson, Mississippi. I went to medical school at University of Mississippi. I did my residency in head and neck surgery. I'm board certified in otolaryngology, which is head and neck surgery. I was always drawn to the face, and that's what drew me to head and neck. It's just the anatomy of the face, and really everything about the face is what I love to do. I went to Gulf Shores and did a fellowship with Stephen Metzinger at the McCullough Institute. I then worked with Dr. McCullough and stayed there for 3 years after that. And then I met Dr. Kingsley and moved to Birmingham.
Here's somebody who knows cosmetic work better than almost anybody. She's now a board certified specialist in vein disorders.
Well, vein work has been a really important addition to my cosmetic practice. It started with spider veins. You know, when people have spider veins or they're concerned about them, they're often concerned about other things. A lot of times it's brown spots or sunspots on the leg. It can be a facelift. It can be liposuction. And so, you know, it's nice to be able to combine that for people and offer them the vein treatment at the same time as their facelift. I think it's really important that we offer an array of services. I would never want anyone to come looking for surgery and that be all I did, or come looking for an injectable and that be all I did, because I think that limits your ability to tell people what they really need.
She's a unique, special person. There aren't many people who have this intense honesty about life.
I mean, I just don't think I've ever met a person that I didn't want to help or care about. So there's a very genuine concern for their lives and how to make it better just from the minute they walk through the door. What I want is a place where people can come and say, this is what bothers me, can you fix it? And most of the time I can. I can do something to really make them feel better. Cosmetic surgery doesn't really say enough of what I do, because a lot of times people come in and it's not about surgery. So they're young people that have acne, they're people that need something as simple as laser hair removal or resurfacing because they're unhappy with their pores. And then there are people that need surgery. There are people that, have noticed that their neck starts to sag, or they don't like the appearance around their mouth is usually where it starts, or people are telling them they look tired. And so for those people, it's more of a surgical thing. But for the most part, what I want is for people to come here and talk to me and tell me what bothers them, because a lot of times, and almost all the time, there's something we can do because we offer such a wide array of services that'll make them feel better about themselves. And when they feel better about themselves, like anytime you feel good about yourself, life is just a better place for sure. I'm very conservative in surgical treatments, any kind of treatment that I do. And it's really because I want people to look natural, and I want them to look, and they want to. They want to look like the same person. They want to look like themselves 10 years ago. And that's really what I think is pretty. I want to look at your before and afters, and I want goosebumps. I want to feel so good about what I did for you and how you look. I want your family to feel good about it. I want everyone you see to say, did you get a new haircut? If anyone asks you if you had a facelift, then I failed, and I still haven't heard that. So that's important, really important to me. When I look at someone, I can see the after, I can see what they need. And sometimes it's not what they came in for. I still tend to tell them. And a lot of times they'll say, okay, I got it. But most people know it's my neck, and usually they're right on. But sometimes I see something different. So I start with just telling them what I see, and I can usually show them in the mirror. This is what it will look like. If it's a facelift, or if this part of their face is dropped, I can tell them to smile, and that's the tissue that we're trying to bring back up. I can pull the skin away and show them how it'll look. It's amazing how many people have already done that in the mirror and know exactly, and they'll come in and I want this, and they'll show me. But that's the gift, is being able to see how it's gonna look and being able to share that with them. The awards that I'm proudest of, for sure, are the awards from the patients. The Patient's Choice Awards, Compassionate Physician Award, that's probably most proud, because I really genuinely am compassionate for other people. And just the awards that patients choose. That top surgeons is very important. It means a lot to me, but there's no question that the Patient's Choice Awards mean the most, because they're from my patients, and that, at the end of the day, that's who I want to be happy, and that's who I want to think that they've got the best doctor. Alabama Vascular and Vein and Petro Cosmetic Surgery share operating rooms. We have 4 AAAHC accredited operating rooms that are located in our office in Vestavia Hills. And we're really excited and proud, because AAAHC means the world to us and to our patients as far as an outward measure of safety and the way we choose to provide care for people.
They look at our credentialing, our every staff member, they look at our medical records, they look at our facility, and they determine if we meet standards of care to offer the very best there is in the world.
To a patient, if I were looking to have surgery, I would certainly want to go somewhere that was accredited, knowing that basically I can go there and have my procedure done in a private setting that's as safe as a hospital, or held to the same standards as a hospital.
I'm Tisha. I'm the master esthetician and laser technician.
My name is Sylvia, and I'm a physician's assistant.
Hi, my name is Stacy. I'm a receptionist.
My name is Emily, and I'm patient care coordinator.
My name is Christina, and I'm a registered nurse.
Hey, my name is Abby, and I'm a medical assistant.
Hi, my name is Lynn, and I work in medical billing and coding.
Hi, I'm Taylor Campbell, and I'm the spa coordinator.
My name is Katie, and I'm an esthetician.
I'm James Brogdon. I'm a certified surgical technologist.
My name is Anna, and I'm a medical assistant.
We want patients to feel comfortable, happy, peaceful when they walk in the door.
When you walk in, it's not clinical.
Patients love coming in here because it's very relaxed feeling.
I think it's a great environment to work in. Patients love it.
We try to make it an experience for patients.
People walk in and say there's the most comfortable atmosphere they've been in, and it is to work in and to be a patient-wise.
I love working for Dr. Kingsley and Dr. Petro. It's great to know that they're the best in what they do.
Dr. Kingsley is a very well-known vascular surgeon. He's well-known all over the United States. He brings the best care to all patients.
He takes his time with his patients. He's very knowledgeable in what he does.
Patients love him. He takes time with them. He makes them feel important. and special, and he doesn't rush through anything. I've been working with Dr. Petro for several years as well, and what's great about her is she's excellent in cosmetic surgery, and she also does vein surgeries.
Not only with cosmetics is she able to have a patient come in for that, but if they have issues with their legs, she's able to do it all at once.
I consider myself very lucky to work beside Dr. Petro. She's got amazing hands. Her suture is amazing.
Dr. Petro gets a lot of referrals from other patients, and that's just the ultimate compliment for a doctor to receive, is to hear that, you know, people are hearing about her word of mouth.
Dr. Petro offers the best level of patient care. As a surgeon, she takes just as much joy in the results as they do.
Dr. Petro and I started working together at the McCullough Institute in Gulf Shores about almost 7 years ago.
She has a very aesthetic eye. She can basically tell anyone exactly what they need to have done.
Patients absolutely love her.
Whether they come for a cosmetic treatment or a vein procedure, they always leave feeling better.
I see our staff going above and beyond for patient care.
Whenever patients call, they don't get a recording. We answer the phones right away.
I hope that people walk away feeling that they have been well taken care of.
It makes me feel good when families feel good and they feel like their loved one has been taken care of. It makes you have a sense of, oh, I helped somebody today.
I hope that patients get the feeling that they had the best doctor, the best service.
You want the patient to feel like they've been treated the absolute best that they can, had the best care that they can have.
A lot of patients have pain, and they don't know why. And most of them are ladies because the female hormones affect the vein circulation more than in men. The veins dilate more, they get more congestion in their legs, and they have more leg pain.
People that have spider veins, a third of those people will have venous insufficiency or reflux of the veins that drain the skin. That causes pain, swelling, restless leg type symptoms. It can cause leg cramps, especially at night. And it can also cause just a generalized heaviness, like your legs feel tired at the end of the day.
We take abnormal vein circulation and we manipulate the pathology of it to the point that the vein circulation becomes normal. We offer treatment for, it's a pretty broad spectrum, but the most common things are spider veins.
Spider veins are really small veins that you see on the surface of your skin. People will say, my friends ask me if I have a bruise, or my kids say, what happened right there? And it's a vein. And spider veins are typically the ones you see. Varicose veins can bulge through the skin and they look like ropey, kind of snake-like, and you see them pushing out against the skin. And then there are reticular veins, which are under the skin but larger than spider veins.
So we treat all of those things. Now, if there are bulgy varicose veins, by definition they have an underlying circulation problem, and we use this laser to close that vein. It's called endovenous laser ablation. Endovenous just means putting the laser fiber inside the vein. So endovenous laser ablation is the core procedure, and then we do the spider veins and the phlebectomies at the same time. It's very safe if you go to the right people in the right place, and it's not painful. You can be back to work in a day or two, and the rest of your life you're much better.
Facial plastic surgery options involve facial implants like cheek implants, chin implants, and then we also offer breast augmentation as well as breast lifts, liposuction. We use smart liposuction, which is a form of laser liposuction, mini facelifts, full facelifts, eyelid surgery, forehead lifts, rhinoplasty. Body contouring is tummy tucks or abdominoplasty, which can treat loose skin around the abdomen. Structural fat grafting is where we take fat from one area and move it to another. So if you've had Juvederm and you know that you like your lips a little bit bigger, we can use fat, which is a more permanent way of making your lips the size that you like them. The spa services that we offer that are the most popular are the facials. We also offer chemical peels. They're lunchtime peels that you can have. Basically just brighten up your skin and make you look fresher. There are laser treatments that can remove tattoos, make pores smaller, take away redness or rosacea, help treat acne, brown spots, wrinkles, fine lines. For cellulite, we have smooth shapes, which just makes a huge difference. It makes the skin feel significantly tighter. We offer waxing as well as laser hair removal. We offer injectables and fillers like Botox, Dysport, Juvederm, Restylane, and Radiesse. These can be used to treat Botox and Dysport treat lines that are created with movement. When you smile, crow's feet, or when you squint, glabellar lines or forehead lines, even lines around the mouth. And we even use Botox for sweating, or what we call hyperhidrosis. Juvederm can be used to fill in lines here, around the mouth, lines and things under the eyes, as well as lips, and add augmentation to the lips. We also have makeup. Our makeup line is Edward Bess, which I absolutely love, and we worked very hard to get after I saw it in New York. It's fantastic, and we offer makeup services and have the best makeup artists there is working for us. The skincare that all three estheticians use, we sell. Guinot is probably our top line, which we're the only people in Alabama that sell it. And Guinot is the facials. We have lift facials that can actually use galvanics to kind of lift your brow and make you look really good when you leave. And Guinot is a great line for that. We sell Obagi also, which is a medical grade skincare. Skin Medica, which is medical grade. And then we have Artist Shaving and Frederick Fekkai and Bliss products, just because they feel good and they're a great combination. So I really don't think it should be all medical skincare or all fun skincare. I think a good mix is really good for most people.
If you suffer from spider veins or varicose veins, you know they can be very unattractive, and varicose veins can be painful as well as ugly. The wonderful thing is there are all kinds of new treatments available that are not only highly effective, but relatively painless and done in such a way that they won't keep you away from work or other activities for long lengths of time. Before we talk about these treatments, it's important to know a little about what causes the problems. I'm sure you're asking, just what are varicose veins and spider veins? Well, let's look at just what the veins in our legs do.
Circulation is a key part of what makes our body work and stay healthy. How our blood circulates through the body is a truly remarkable thing. Our blood carries oxygen and nutrients throughout the body. The heart is the pump, and our blood vessels are the pipes that circulate that blood throughout the body. Arteries deliver the blood to the body. Veins return the blood to the heart. Since we spend a lot of our time standing or walking, our circulatory system has to fight gravity to push the blood in our veins back to the heart. The pressure in our veins is very low, and there is no pump in our foot to send the blood upstream. Blood flows in our leg veins toward the heart and is assisted by small cup-like flaps called valves, which are spaced along the inside walls of our veins. These valves open upward so blood can move up. When the valves close, they keep blood from falling back down in the veins. But sometimes our circulation becomes impaired. When that happens, the blood flow back to the heart is reduced. Your muscles still try to squeeze the blood back up through your veins, but if your valves have become damaged or weak or injured, they just can't keep the blood flowing upward, so some blood drops back down the vein. This puts excess pressure on the other valves in the veins below. This extra pressure starts weakening and dilating the veins in the skin of the legs. By the end of the day, a person with this problem will have accumulated extra blood and fluid in the lower part of the leg, especially around the ankle. This causes a condition we call ropey veins. That is, a vein with sagging walls, which cause the vein to bulge or twist like a rope. Sometimes the enlarged veins allow the blood to pool or fill up the vein without moving upstream. The result is often the formation of a blood clot, with subsequent inflammation leading to the diagnosis of phlebitis.
The spider vein issues are an important topic to discuss in any discussion about vein disorders. A lot of people look for correction of spider veins, and especially the younger girls all the way up to the young ladies in their 50s and 60s, and some surprisingly in their 70s and 80s. I think it has to do with the fact that they had these unsightly veins. Some were uncomfortable all their life, and they would really like to have them disappear, and finally there's a good option to eliminate them. So they'll come in and we'll see them for those problems as well as more serious problems, and they'll ask us to please please go ahead and eliminate these, get rid of these spider veins for us. I think the thing to understand is that in a third of our patients who come in with a spider vein complaint, a third of the patients have an underlying more serious abnormal vein circulation problem. So we identify that with ultrasound, and we often counsel our patients to correct the underlying problem at the same time as we begin to treat their spider veins, because if we don't, their spider veins will simply return. The Italians came out with a way to take a sclerosant called sotadecol and another one called polydocanol and mix it with air and make a foam out of it. And the foam sclerosant has tremendous potential, and it's more powerful and it's safer. It lets us lower the concentration, and it just flat eliminates these unsightly veins. So we use in our practice a foaming sotadecol solution, and we modulate the concentration based on the size of the vein and the location of the vein. We tend to inject with very, very small needles. It's not a painful procedure. We use a little 3 cc syringe, and the needle size is either a 30 gauge or a 32 gauge, which is about as small as we can find, or as small as is made. So the needle punctures are not, sometimes you don't even feel them. They're a little bit pinchy, but other than that, they're not painful. And then we inject this solution, and it's not that when you have spider veins that you inject every little spot. You can inject one area and a whole fan area will flush out and then and over the next few weeks fade away. One of the things we counsel our patients is one treatment is not going to eliminate these small veins. They're the most difficult to get rid of. So we plan on a several-month course, and we'll treat them and we'll observe a month or two later. We'll treat again and we'll observe a month or two later. We're successful usually in about 3 treatments. We have some patients who are going to take longer. We have some who will take less.
We offer a really great opportunity for people to treat as much as they can at one setting. Like if you look at their legs and they're there for spider veins, they may have a lot of spider veins, but they may also have other things. Spider veins and veins aren't just on the legs. There are a lot of patients that have veins on their face that can make their complexions look uneven, and we can also treat the veins on the face. There are veins on other parts of the body. I mean, there can be veins on the breast, veins on the abdomen, and all of those, as well as in the hands. And sometimes people don't know what bothers them. You know, their spider veins are gone and they're like, I still don't like my legs. There's so many other things we can add to a spider vein treatment to set our treatments way apart from anything else you could get. Just the chemical peels will slough the brown skin. The laser treatments will treat the brown spots. I mean, we can take an average leg and just make it spectacular. But it takes both sides. It takes a combination of treatments.
If a patient comes in and they want to be consulted for spider veins, they can anticipate we're going to recommend an ultrasound examination of their leg vein circulation. And the reason for that is to detect if the spider veins are a sign of a more serious underlying vein circulation disorder. Patients can come in and have spider vein treatments and drive themselves home, and all we do is recommend compression stockings for 4 or 5 days.
When patients come in and say, thank you so much, which is really what a vein clinic is made out of. I mean, people are so happy, and a lot of times they had no idea they could ever do anything to make their legs feel better, look better. I mean, they had no idea it was even available.
I was having a lot of issues with it felt like weight in my legs, especially toward the end of the day. I just felt a heaviness in both of my legs. I did not have the typical veins showing, but I did have that discomfort, and so that was something that was progressing. And as it progressed, I became a little more concerned because it started to be earlier in the day that I would have problems. I saw Dr. Kingsley one night when I was recovering from the surgery, and I started to wonder, could that be part of my problem? Maybe there was something there besides just being tired or just carrying a little extra weight, and that was when I started to pursue it, and I came and made my appointment here. First I made an appointment, and I came up here and they did the ultrasound on my legs, and they could identify that the valve in the top of both of my legs was faulty. It wasn't working correctly. Then I went to the group session and watched a video, which was similar to the one that I had seen that night on TV. And then I met one-on-one with Dr. Kingsley, and we scheduled surgery for that to correct that problem. It was about a month after that I did the first leg, and then it was about another month before I did the second leg. You have to wait 2 weeks in between, but just because of some scheduling issues, mine were a month apart. When you come, they're very nice, and they give you something when you get here sometimes, and that was the case with me. And so by the time you get back to the room, before you get an IV, you're already feeling a little more relaxed, and then they give you an IV. In my case, I was totally out. I was asleep. I did not feel anything. I remember very, very little up until the point that I really got home. But there was no pain involved in the actual procedure. Before the surgery, I had gotten to the point where what had been afternoon discomfort, 4 or 5 o'clock in the afternoon, had become 10 o'clock in the morning discomfort by that time. And I would be so frustrated because by the time I would get up and get dressed and really get going for the day, I felt like I needed to sit down because my legs felt so heavy and I felt so much pressure. And I didn't realize how much swelling I had because both of my legs were involved and they were both swollen. They were still roughly the same size, and it happened gradually over a period of time. So the change in that is inches for me, dramatically. Changes in the way my clothes fit, specifically jeans or pants. At Christmas, I was able to wrap packages, and after I wrapped them, I realized I had been sitting on my knees to wrap packages. Things that people would take for granted. I couldn't sit on my knees before. When your legs are swollen, you can't do that. To be able to sit on the floor with the children and play a game cross-legged and stand up and walk. Just those things, in addition to a relief of the pain in the afternoon. Now I can pretty much go all day and I can pretty much do whatever I want to do. And at the end of the day, I don't have that swelling and that tenderness and that soreness. The color of my legs has changed. I didn't realize, being a fair-skinned person, over a period of time, my legs have become kind of pink. And now they're back to white, and you're glad to see the white legs again. I thought scheduling was smooth. When I came, the facilities obviously are very clean. They seem very organized. They're ready for you. There's very, very little wait involved, whether you're coming for a surgery or another appointment. It just runs like a well-oiled machine here. It is something that they do a lot of, and when you're going to have surgery, that's something that I'm looking for. I want to see people that know what they're doing, people that have done it before, and people that have done it regularly, and that's what I found here. Plus, they were very nice. I think a lot of people are waiting to see what they consider to be traditional varicose veins, and it's been really nice for me to be able to share, hey, don't wait. If you're having that discomfort, don't wait until you see something, because there could be something going on before you see those traditional varicose veins, and you can avoid a lot of problems by going ahead and handling it, plus the quality of your life in a procedure that's pretty simple and it's outpatient. It has a pretty low, recovery is very quickly. For me, of course, the swelling was there, which I didn't realize until later how much swelling I had. But like I said, I did not have the traditional varicose veins, and I thought that a lot of those surgeries were for people who were older than I am, people who had more visible issues than I had, and that was just not the case. For me, it has been a life-changing thing, and the reason I wanted to come is I feel indebted at a certain level, almost emotionally, to Dr. Kingsley and his staff, because it has really improved the quality of my life. And if there's someone else that's out there that needs corrective vein surgery done, and that would be helpful to them, I would certainly want to let somebody know what it's done for me.
I worked night shift for 6 years as a labor and delivery nurse and through 3 pregnancies, and I had some very large varicose veins on the inside of my calves, especially my right leg. And my right foot would swell, my leg would swell, and it would become very uncomfortable. And it was very unsightly. A friend of mine had used him maybe a year or 2 before I did, And she saw my veins, and we were at the lake one day, and she referred me to him. So it was in the last summer, she told me, so I thought I'd get it done in the fall. I was looking for quick and easy, and insurance to pay for it, and a competence, experience. My friend showed me her legs; they look great. She told me her experience, and it was great. So when I asked questions about, when he explained to me the dilation of my vein and how it was fairly large for my age, I could understand that, and I believed him, and he was right, and I've improved greatly, and the results have been wonderful. Before, I would wear shorts and skirts and dresses, but I was always self-conscious. Especially my right leg, I'd stand in a way to hold it behind my left. I'd stand with my feet in a way so that it wasn't so obvious. And then now that it's just starting to be summer, I keep standing that way and remembering that I don't have to do that anymore. Also, my legs would retain water during the day, and then when I'd go to bed at night, I would have to get up to go to the bathroom 3-4 times at night, especially towards the end, because all that water that had been retained in my legs from gravity and standing was redistributed in my system, and my kidneys would filter it out at night. So I was getting up several times a night to go to the bathroom, and now I don't. I came one afternoon, and I sat in a room and we watched some testimonies, and we listened to Dr. Kingsley speak, and then I had an ultrasound done of the vein, and then I was taken right into a room, spoke with him. He saw me, saw the leg, said, let's get her approved, get a date, and it was done. And it was one afternoon, all set up. I had to do both legs, and both appointments were set up that day. Surgery was a piece of cake. I came in the morning, my husband dropped me off, and it was almost a vacation for me. I have 3 young children. I got to go to sleep and wake up and not have to be on my feet all day. Just one day of in the bed and being waited on, and then after that I was back to normal pretty much. On the right leg, he did have to do the incision right at the top of my right at the groin because the vein was so large, to tie it off. That he says he does that just as a precaution. I think everybody's very professional and friendly and warm. Anytime I had a question, I would call. I didn't have very many because they were so good at explaining things. The packet they give you is very thorough. And he gave us his personal cell phone number, which I never had to call because I never had any problems. It was just a piece of cake both times. I wasn't even nervous. It was very easy. I can't, right now at the time in my life with 3 young children, I can't afford cosmetic surgery, elective cosmetic surgery. And so one thing that I was looking for with a doctor, and one thing that drew me to Dr. Kingsley, is that this wasn't cosmetic. This is also quality of life and a medical procedure. And as soon as I heard insurance would pay for it, I said, let's do this, because this is miserable. And when people tell me, oh, it's just cosmetic, it's really not. It's more than that. And so when I found out that insurance would pay for it, and they did, the only thing I paid out of pocket based on my insurance was $60 for the pantyhose for the entire thing. I would highly recommend, yes, getting this done, especially if you have problems. They don't even have to be as big of problems as I do. Don't let them get to the point that mine were. I don't have any problems anymore, and I still, like I said, subconsciously I still try to hide my legs, now that I'm wearing shorts and skirts, but I don't have to because they look great.
I'm an avid exerciser, and I run about 5 miles a day and work out in the gym 4 days a week. But there were some areas that I could not fix to my liking. I've always been a confident person, and I've always had great self-esteem. But being in sales and being in front of people on a daily basis, there were just certain areas that I would pick myself apart about. And they were just areas that I knew if I could fix with a less invasive surgery, why not do it? I needed something very minimizing, something that would not take me out of my career or being a single mother. The vasor liposuction is what I was interested in. I was looking for the less invasive. Like I said before, I'm very busy and in sales. Therefore, I didn't have the time to take off, and with having an active little boy, I wanted to do something where it would be quick turnaround and recovery time. I got online and started doing some research and found out that Petro was one of the only doctors in the area that offered several services that I was interested in. I did have liposuction, the vasor lipo, in August, so almost a year ago. Well, something that Dr. Petro did stress to me was liposuction is not to reduce your weight. It's actually to contour your body. So the main objective was certain areas that I had that I was not pleased with. And I can tell how my clothes do fit differently. Certain, jeans, dresses fit better, and I feel better in them. It is known as a less invasive surgery, and sure enough, I came in one morning. I was prepped, blood work, local anesthesia, and I was in and out in a couple of hours. I did take off a Thursday and Friday, and then I was back to work on a Monday. From my vasor lipo, Dr. Petro took the actual fat cells from which she removed from certain areas of my body and then injected them around parts of my lip. And actually I had it in my lips as well. I, had very thin lips. They bothered me, but I never considered doing anything until she mentioned it to me, and it was very, very modest. And I explained to her how I didn't want a certain look, and I was very, very pleased with the outcome. I don't want to have the plastic look or any fake. I'm very, very natural. A lot of days I don't wear makeup, therefore I didn't want to look out of the ordinary or not the norm. And I brought magazines in and I told Dr. Petro, I said, I really like this, I do not like this. I explained to her that I was terrified of having big lips that looked reversed, and she said, I would never do that to you. Smooth shapes is something I started right after I had the vasor lipo. It's actually a procedure that heats your skin, and they use an instrument that it's kind of like a vacuum that goes over certain parts of your body to smooth and tighten the area. So it really helped the healing of my vasor lipo, and it also gave me a very smooth and tight feeling on the back of my legs. My clothes fit better. My jeans, those, your favorite pair of jeans that you were used to wearing that were a little tight, fit much more comfortable now. My dresses, just the way people will come up to you and they say, oh, you look great, you look different. They can't pinpoint what it is, but they can notice a change in my body. So that, of course, is, a confidence booster. The one thing I can say about Dr. Petro and her staff is every one of them are very personable. They're great to work with. I feel like I know them not only on a medical level, but a personal level. It's very comforting to come in and it not feel like you're in a hospital or a doctor's office.
Yeah, I was bus driver 49 years, Jefferson County school system, and also run buses and had buses and things for myself. I used to run charter buses and things, but now I'm retired, 77 years old now, just taking life easy. I had a bad leg here, and I guess it had been in bad shape for about 20-some years or more before I come to Dr. Kendra. It'll heal a little bit, and then it busts back open. But I came to him, he did surgery and everything, and now it's healed up and thing, and it's doing good. And well, it's been about 4 years or so now, and everything. And last time I was here to see Dr. Kendra, he said it was still doing good, and I think I was supposed to come back in he gave me about 6 months to come back to see him again. Other than that, I get around and work in my garden and do little odds and ends. The doctors I had went to, they had gave up on me, on that leg and thing, and They didn't know where it come from or nothing. And I didn't know where it come from. Just all of a sudden it started breaking the loose, and souls began to spread out, and it'll heal up a little while, and then all of a sudden it break back out. But so far, Dr. Kingsley have did a good job on it and thing, and I ain't got no problems at all. I mean, I still can move around and work and cut my little grass and work in my garden and thing, so I'm proud of him. I give him credit 100%. He's a good doctor.
I'm a grandmother and have 6 grandchildren, retired nurse. For a long time I had wanted to do something especially for my neck area, because I like to pretend like I'm younger than I am. She did a face lift, mostly involving the neck area, pulling all that skin up, and also some around my eyes. I feel younger and more stylish, and it's easier to put a wardrobe together, so it's been a positive experience. I shouldn't have waited as long as I did. Taking that first step is the hardest one. That was for me anyway, and having somebody to recommend Dr. Petro, that was helpful. I think that the staff is very knowledgeable and helpful, and I was glad to know there's an anesthesiologist here for surgery, because that was one of the conditions that I don't think I would have had surgery if there wasn't an anesthesiologist available. So that worked out good. Their instructions before and after surgery were very helpful, and I think Dr. Petro's a top-notch doctor. I think she definitely understands what women need and want, and it's easy to talk to her. She answers all questions, and I definitely think that's a plus.
The problems that I was having is I was having just unbearable pain in my left leg. I mean, it's a pain that is just really indescribable. And in the midst of the pain, I was still having to work full time and be a mother, and just try to have an everyday normal life. And I have an ulcer on my left ankle, and that is what was causing the pain. The question was, what was causing the ulcer? And after all the doctors that I've seen, countless amount of doctors, Dr. Kingsley was finally able to diagnose, what was wrong. I remember when I came back to Dr. Kingsley, I called because one of the doctors that I was seeing, he basically dismissed me. He said that the only thing that he could recommend for me was amputation. And I will never forget leaving his office so devastated. And when I left there, I was like, there's no one else. I've done my research. I live in Montgomery, Alabama, and Dr. Kingsley's located in Birmingham. And I've done my research, and I've seen the 2 doctors, other than the one that recommended the amputation. I've seen them already. So who do I go? Where do I turn? And I don't know how, but I thought about Dr. Kingsley, and I literally called his office in tears, just hysterical, in tears, saying, I don't know what to do. This doctor just recommended that I get an amputation. And his staff, the girl who answered the phone, she was just phenomenal. I mean, for her to take the time to, 1, calm me down, and 2, she was willing to see me right then and there. She asked me, she was like, can you come now? And she was like, I just want to assure you that if we can't help you, then we will get someone who will. Any treatment that I was receiving was done to the wound itself, but nothing ever internally like what Dr. Kingsley has done. He was able to come in and literally diagnose that the problem was with my veins, and that is what was causing the pain and also the ulcer. And needless to say, I've gone from being on medication, from antibiotics, just constantly in and out of the hospital, from being, the sore itself would get infected. And then, of course, that would just be very painful, so I would be on prescription pain medicine. And the first time I met Dr. Kingsley, he told me that he was going to completely get me off of that. And in my mind, I was like, yes, but, is that really going to happen? And it has. I mean, it went from me taking pain medicine and antibiotics year-round to nothing at all. You know, I went to where I could just take a leave, and then now I don't even have to take that anymore. Procedure, when I came, I remember meeting one of his staff members, and Zeke, he comes in and you go and see him, and he does kind of like what they would do, like an ultrasound, and they are literally able to look on a screen and see what your veins are looking like. And he decides then if you are a candidate to see Dr. Kingsley or one of the doctors, you know, for your veins. And of course I was, and I just remember, you know, meeting Dr. Kingsley and them going forth and saying, this is the problem, and, you know, we are going to go ahead with, you know, the surgery, the vein surgery. The surgery itself was very, I don't remember because they put you to sleep, and it was very successful because, like I said, I went from being on antibiotics for pain and infection, and to just, like I said, I went to just where I could just take a regular everyday over the counter to no pain at all. So apparently it did fix the problem. And that has just truly, truly touched me, and needless to say, they have helped me. I mean, his staff is just phenomenal. When you walk through the door, they always greet you with a smile. And even if you're running late, you know, coming from Montgomery, sometimes traffic doesn't always agree. And, you know, that just really means the world to me, that you can call, you know, his office and get a friendly face, you know, friendly voice, and then you come in, you get a friendly face, and when you leave, I mean, they're just all around. His staff really represents who he is. You can't turn on and turn off Dr. Kingsley. You can't be that type of, a different type of person on the outside of work and then come in and turn it on. I can tell he is really genuine. I actually asked several friends of mine, I said, what do you remember about me and all that I've gone through with this sore on my ankle? And they each have their own little stories saying, I remember when you first told me, or I can remember when we were at the beach and you were in a lot of pain, and I can remember, I mean, I can go on and on about all the things I've gone through and how the sore itself has affected my everyday life, from taking a shower to preparing to go to bed to preparing to go to work. And now that I've had the surgery, I have a better quality of life.
I'm retired. I was an Army soldier. I was in combat boots for many, many years. My right ankle, I had some varicose veins and some problems with discoloration and purplish, blackish ankle. And I came and spoke with Dr. Kingsley about taking care of the varicose veins. That's when I found out there were underlying issues, and I went through the ablation surgery, and I am very pleased. My legs feel like they're 20 years younger. I didn't realize all the things that were wrong. I just assumed all of that was a part of aging. I couldn't walk up steps without stopping every 2 or 3 stairs. I couldn't walk up a hill in my backyard without stopping to rest partway up. And a lot of difficulties like that with the climbing and the walking that I didn't know was related to the veins in my legs until after the surgery. I couldn't stoop down to get things from the lowest shelf at the grocery store. I couldn't bend down to talk with the children or pets. And I didn't relate that to being part of problems with the veins. But now I can do all those things. I got a referral from my sister who came to Dr. Kingsley for spider veins. And she told me that he would take care of varicose veins as well. So I got a referral from my sister. I met Dr. Kingsley. I went into his Oxford office, and when I went in, the technician came in and did the ultrasound, and he said, "Oh, your valves don't work." Well, of course, I was in shock because I didn't have a clue what he was talking about. So Dr. Kingsley came in and explained it all to me, that the valves in those veins in my legs did not work, either leg, and explained to me what all procedure would be to correct that, and how much better my legs would be afterwards. I didn't feel any pain or anything. I took the pills, the Advil, like he told me, the 2 weeks before and to the time afterwards. I didn't even require any other major pain medication for that. So it was very easy, simple procedure. I mean, from my perspective, I'm sure it wasn't from the other side. Prior to my surgery, like I was saying, I couldn't walk up the hill in my backyard without stopping along the way for my legs to catch up or not feel so heavy and full. I guess that's the main thing. My legs always felt heavy and full, like they're gonna pop, kind of. And now after the surgery, I can walk up the hill, I can climb stairs, I can climb the ladder. My legs don't have the heavy and full feeling any longer. And when I stoop down, crouch down and get up, I don't have that feeling of an overfilled balloon in the lower legs. I would highly recommend it to anyone that has spider veins or varicose veins to come in and get checked to see if those valves are working properly in their legs. So I had my surgery in Birmingham, but I usually do my doctor office visits in Oxford, Alabama. It's about halfway to my house from here. Everybody's very polite and helpful. Everybody's always cheerful, and everything is just very pleasant in both locations.
I have been on my feet due to my job for over 10 or 11 years, and it just seemed like every day when I would get home from work, my legs would burn, ache, just be in excruciating pain. Even when I sat down, you know, at the very end of the day, it was like they were on fire. And I knew, you know, from the cosmetic standpoint, the way they looked, I also did not like, but also from the physical aspect of it, I felt like maybe there was probably something going on the inside that needed to be treated as well. I exercise a good bit, and I like to run, and I just didn't feel like I was up to par for my age. I didn't feel like my legs should be feeling the way they were feeling for my age at this time in my life. And I do know I have probably some genetic history associated with my legs as well. I've seen it in my mother also. So I did go ahead and have an ultrasound done here with Dr. Petro. Dr. Petro is very compassionate. She has a phenomenal bedside manner. Very easy to talk to. After the ultrasound, Dr. Petro talked with me about the results and told me that I had some venous insufficiency in both of my legs, actually, and that I probably would get some improvement with the symptoms, both, cosmetic and mostly, the physical. If I would elect to have an endovenous laser ablation procedure. It was very, very easy. It was probably easier than I anticipated. The actual procedure itself, I didn't feel a thing. Thank goodness. I'm very thankful for the nurse that took care of me. And I stayed off of my leg that day, just as I was instructed. Had very minimal discomfort, and that weekend I was doing my regular stuff.
I'm a hairstylist in Tuscaloosa, and I have a son, 2 grandchildren, and I love my work, and I was starting to look a little tired. I'm 59, I'll be 60 my birthday, so I just felt like it was time for me to make myself look a little youthful because I am in the beauty business. Women start getting these jaw things, and I was getting them really bad. My neck was driving me out of my mind. It was very wrinkled. I had already been to several doctors in town, and I just been kind of doing my homework, doing research, and I just feel like when you meet a doctor, you really need to click. Your personalities need to, you feel like you have to feel that comfortable. And that when I met Dr. Petro, that's exactly how I felt. I felt very comfortable, and I believed in her. When you go to a cosmetic surgery into the office in the first place, her office staff are beautiful, and when they greet you, and I just feel like I want to see that. I don't know, I've been to several places, and I felt like everybody in there looked tired. I felt like I looked like they did. And I love the professionalism, like all the cosmetics and all the stuff that they have for your body, for your well-being. That to me meant a lot. My husband was a wreck for me having to do this. He did not want me to do it. I think he thought it was going to change my looks. You know, I think he didn't want me to look any different, you know, and I look the same except I look fresh. I don't look tired, you know, and I think as you age, when you start sagging through here, you get a tiredness. The day of the surgery, Dr. Petro walked in and she said, "I don't want you to do the surgery." And I said, "Why?" And she said, "Because he's got to be on board with you. And if he's not on board because he'll have to take care of you, then you don't need to do it." And I looked over at him and he said, "Okay." And he changed his whole attitude and he's loved it. So it's been good. I've also had Botox done in my forehead. And I love it because it lifts my eyebrows up a little bit. You don't have to have any surgery done to have that done. Because, I mean, even if you don't have a facelift or anything or anything else done, just having that little bit of Botox put in around your eyes and your forehead just gives you a fresher look also. I look the same other than I look like I did probably 15 years ago. You know, I don't, because I've looked at pictures and I go, yeah, here I am. And all my clients, they come in and they go, "You look so rested, you look good." They're not realizing what it is, and that's kind of neat.
I had been retired, I guess, a little over a year, and I started developing problems with the veins in my legs, especially my right leg was the worst. And it was in the ankle area. I developed these ulcers. I saw a doctor pertaining to the veins. They treated me for several months with some medication, wound care type, like that you would apply to the wounds, at times taking rest times, elevating my legs. But none of this seemed to work. Some of the time we would get a small ulcer to heal, but then I would break out with another one in a close area close by. I suffered with this and I had the problems for 2.5 years. They did the ultrasounds here. They told me it was definitely from the varicose veins, and he explained to me about the procedure that they have now for this. It's not a really invasive surgery at all, and I wanted something done at this point because I had been suffering for a long time. And I was just happy that I was sent somewhere like to Dr. Kingsley, that I felt like I could get some relief from the problem I was having. And it is a very painful situation to suffer with ulcers caused from this type of problem that I was having with the veins. My first visit was the 1st of January, so on that same week, by Thursday of that same week, I had my procedure done, and I was thankful I did. Well, it wasn't a bad procedure at all. They give you, mild sedation. You are put to sleep, but it's not like a real deep sleep, and it isn't a bad procedure at all. You just have a few days to take it easy, recover. It isn't like a major surgery at all. Well, I was feeling much better within 2 to 3 weeks, but then I was feeling much better after my 6 weeks checkup. Dr. Kingsley told me that my ulcer would heal. That would completely heal. And it was healed when I came back for my 6 weeks checkup. Now, I had my second procedure only 4 weeks ago on my left leg, which it wasn't near as bad as my right leg, but we wanted to do it so that I would not develop the ulcers and have to suffer with it like I did my right leg. And I'm doing great from it. It wasn't near as much recovery from it. Dr. Kingsley and his staff, all of the staff here are very nice. They treat you with a lot of compassion, and they show that they are concerned for you and your problem. And I'm just very happy that I was sent here to Dr. Kingsley. He's wonderful.
I'm a homemaker, mother of 3, and I was working out about 6 days a week, hour and a half each day. In the meantime, I developed bursitis in my hips and had to quit my strenuous workouts. But I wasn't happy with the results I was receiving, And so I did some research online, had a consult with a couple of physicians, and chose Dr. Petro as my physician. And I've been very happy with my results, and I'm better shape than I've been in about 20 years. She's just very, very outgoing, very sweet and kind. I always felt very secure with her, very confident of her skills. And also, when I finished my surgery, she actually took me out to the car, which I was very impressed with, you know, and told me to call her if I had any problems. I think she understands more that you have this little bulge you might want to get rid of than a male might dismiss, oh, you're fine. I think you come to terms with, okay, this is just the way it's going to be. I'm older. I'm not going to have the body I had when I was 25. But with Dr. Petro, I felt she was understanding what I wanted to accomplish with the surgery, because I was already a size 4, but I didn't want to be smaller, which the surgery doesn't make you necessarily smaller. It got rid of some fat deposits because of hormones and aging that no matter how hard I worked out, no matter what type of pill I took, I just could not get rid of them. I was working out 6 days a week, and with boot camp, personal trainers, eating, clean eating, what I call, you know, protein, high protein, vegetables, and it just wasn't coming off because of age and hormones. And she was very sympathetic to that. I did the lipo on my flanks and my abdomen. In the beginning, they put you under full anesthesia. I just remember them telling me I might feel a little drowsy. And the next thing I knew, I woke up a couple hours later, and that was it. Came in, and I was put under by the staff, very professional, very nice, and woke up, had a little bit of bleeding, and went home. Didn't even have to take pain medication. Within 1 week, I was back in the gym. And recovery time for me, I felt like I had a strenuous workout. You know, I did have trouble maybe sitting up a little bit with my abs, but that only lasted a couple of days. And I was literally in the gym a week after my surgery. There was some swelling, and I did have to wear a compression garment for 6 weeks, which is minimal for the results. But I noticed about 6 weeks later, my jeans, where I'd had some hangover on my flanks, on my jeans, they were no longer there. And where my abdomen was hanging over my jeans, it was just no longer there. So probably about 6 weeks out, I noticed really huge results. I saw very dramatic results in my flank and my abdomen, where my abdomen used to hang over my pants. My jeans especially, I no longer have that. My smooth shapes, I have a little bit of cellulite, which the liposuction does not get rid of, on the back of my legs that she's going to do next. And I'm hoping, I know that's going to tighten my skin and just make the overall appearance of my legs for the summer better. I'm very excited and happy with mine. Something I could not achieve these results in the gym after years and years of working out. And also, I was inspired. I've been trying to lose about 10 pounds for 3 years. I felt so good about my body. It just gave me the motivation to get in there, start really eating clean, and I lost the 10 pounds. Yeah, I'm confident putting on a pair of jeans or tight pants now, or a tight skirt, where before I wasn't, because on my flanks I had these bags hanging over, and I wanted to feel like I was confident in them, but I really wasn't. I felt like I looked like an older woman trying to look like a 25-year-old. But now and the results for me were not that people said, oh gosh, you've had something done. For me, it was that, wow, have you lost weight? You look really good. And I really like that part of it, because nobody knows what I've had done. They think I'm just working out really hard and aged very well. And I do like that part.
I'm an accountant. I have a little boy who's 11. I came to Birmingham to see Dr. Kingsley about my veins. It was really bad varicose veins. He did the surgery. It was an amazing job. I actually met Dr. Petro from dealing with Dr. Kingsley. It was by sheer accident. She just happened to be with him that day. And so we talked, and I was concerned about extra weight and the look, you know, in my hip area and my thighs. And so after talking with her, I felt 100% comfortable. And so she brought me to the office, and we decided to go ahead with the Vaser lipo. I would recommend it to anyone. It was a great experience. The downtime was only a couple of days. I did take off a couple of days plus the weekend. There was minimum pain the day after, but the personnel here is absolutely wonderful. They check on you. They make sure you have everything you need. So you're actually up walking the next day. So I would definitely recommend it. The visual effects is amazing afterwards. So wonderful, wonderful. Dr. Petro is just amazing. Cannot say enough good things about her. So she just has the technique, the knowledge, and but of course the main thing is feeling so comfortable with her. So no matter what crazy question you have, you know, she knows what the answer is. But for me, the most important thing was just feeling so comfortable with her that, you know, we could actually do this, because this was my first time and I was nervous, so it was great. Oh, I do feel better. I just feel better about the way I look, and so that's important, especially, you know, when you're busy and you don't really get to take care of yourself, you know, the way you'd like to or want to or all that. So the whole process of everything being so you know, so quick with the recovery, and yet being able to achieve what you want to achieve is just amazing. Because most people, you know, are go, 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 and they don't have a lot of downtime. So just the whole process of being able to achieve what you want to in a limited amount of time is amazing. The facilities, the staff, the office, the whole process is incredible. I don't know how they've done it, but they are amazing. Everyone here is so helpful. They're extremely helpful financially. So like I say, and everyone is knowledgeable in what they do. Like I say, I have no idea how they've done it, but they have a firm package. Wonderful people, extremely knowledgeable. I would definitely recommend Dr. Kingsley for anyone who has any varicose veins needs. He's amazing, he's wonderful. And I would definitely recommend Dr. Petro for any cosmetic surgery, any type that you think that you may be interested in. She's an amazing professional, she's extremely knowledgeable, and the results are amazing. So they are an awesome team, and I would recommend anyone to Dr. Kingsley and Dr. Petro for those needs. They're amazing.
I'm 26 and I battled with acne for as long as I can remember. I would not wish acne on my worst enemy, and I had scars all over my face, and it was just very, very difficult to get up in the morning, and I had to cake on the makeup, and you know, I walked with my head down, and so I got tired of doing that, and I did some research. And I found Dr. Petro, and what she said on the website was wonderful. Of, you know, you don't have to suffer with this. There's things to make you feel better, make you feel confident, and you don't have to keep your procedures in the closet, because if they make you feel good, then do it. So I simply made an appointment and came here, and they definitely changed my life for the better, as corny as that sounds. Of course, our staff is amazing. This facility is amazing. It's bright, it's warm, it's cheery. Dr. Petro is a woman, and she's understanding, and she's not judgmental, or you don't feel like she's, you know, looking down at you for doing this or asking questions. Her goal is to make you feel better, and to wake up in the morning and like what you see in the mirror. And I think she does a wonderful thing, because she's all about confidence and, you know, making a woman feel good about themselves. And she does a fabulous job of it. The procedure I had done was the CO2 laser resurfacing. And it's simply they apply numbing cream. It's about a 45-minute process. They apply the numbing cream for about 20 minutes and wipe that off. And she just has this laser that she goes over your face with. It's, you know, it's on a scale of 1 to 10 pain-wise, I'd give it about a 2 or 3. Recovery time, to be fully recovered, is about a month, but it's nice because you can see the progress happening each day. You can see your face getting better and better and better and better. And once again, I was in and out within an hour. I could shower, and I applied cream for a month, and now I'm scar-free. I have so much confidence. I enjoy getting ready in the morning. I don't hide from mirrors anymore. I, enjoy shopping, and, something that I just didn't do before because there were mirrors around. And, I don't feel like somebody's staring at my acne scars or wondering, I wonder what her issue was. I know they're listening to me and staring at, my eyes, and I don't have such a complexity about, I don't have to get up in the morning and cake on the makeup, and I can be one of those easy breezy girls that can dust on her powder and walk out the door. So it's just really opened a door for me. I feel like a whole new person just because she removed a painful chapter in my life. I closed the door on having to flash back to, dreading events, and stuff would be months away, and I'd be like, oh, I hope my face looks okay by then, or I hope my scars don't show, or, maybe I can wear my hair a certain way and it'll cover some of my acne scars. I don't have to worry about that anymore. I can wear my hair up. I can wear my hair in a ponytail, and that stuff I have not been able to do, 7, 8, 9 years. I had the CO2 laser resurfacing done 3 months ago, and then I had breast augmentation done about 3 weeks ago. So I came here for one procedure, and I decided that I loved her, Dr. Petro, I loved her staff so much that I wanted to go through with another process or another procedure. The breast augmentation, that's so in the closet, and people blow it up to be this huge, painful, long, surgery, and it's not. You go in, you have minor anesthesia, and you wake up 45 minutes later, and you have a beautiful new chest that looks fabulous. And what's wonderful about Dr. Petro is I never had to worry once, are my breasts going to be too big? Is she going to make them too big? Never. Being a woman, and she can relate to wanting to look good in your clothes but not wanting to look, too big or fall out or have to buy a new wardrobe. She solves that problem. You bring her in pictures, you have consults, she makes sure we're both on the same page, and it's been wonderful. I don't feel like I'm drowning in my clothes. They fit better. I feel and look skinnier. Bathing suit shopping is wonderful. I cannot tell you how much money I've already spent on bathing suits. I don't have to look for one specific bathing suit. But also with the size that she gave me, I don't feel self-conscious that everybody's staring at my breasts because they're so big or it looks so different. No, it's very proportioned to my body, and Dr. Petro is amazing at doing that and making sure that everybody's happy with and has the perfect size for their body. You get amazing results that when you walk out this door, you're going to be satisfied with for here on out. You're never going to doubt yourself, why did I get this done? Because you look that good and you feel that confident with Petro's work.
I had concerns with my outer thighs. No matter how much I worked out or how thin I had gotten, it didn't help. I still would have little fat on my hip area, and I didn't like it because I didn't like the way the pants fit me. I didn't like the way skirts and other clothing fit me because I would have to get a different size to fit my hips. So that was the first thing that really, really bothered me. And when I discussed it with Dr. Petro, and she's like, it's just, you need a little lipo there. Sometimes you have localized fat area and you need to have it taken out. And that was a quick and easy procedure. Dr. Petro was my surgeon for my lipo procedure. I work with Dr. Petro's patients every day, and they trust her as a surgeon, and they love her as a doctor. She's a world-class surgeon. She is board certified in phlebology and in otolaryngology, and that's a strong combination. My biggest concern about the surgery when I had it done was how sore I was going to be afterwards. That was honestly my biggest concern, because everything else was explained to me so well, and it was more of how sore I was going to be when I had to go back to work. So it wasn't as bad at all. I had 2 days off. Didn't hardly take anything but ibuprofen, and it was easy recovery, and my results were wonderful. I was extremely happy. It just makes me feel really good that I did it. I enjoy being able to go in and try on stuff and purchase things that I wouldn't normally purchase, because I would have had to get them in a different size and have them altered, and I hate having to do that. So I wouldn't buy certain things because of it. But now I feel like I fit in everything the way I want to. And it wasn't so much in how I looked. Some people think with liposuction, how you look naked or in a bikini or however, it's how you look in your clothes. That's the most important thing. And I mean, that makes us feel good when we buy something new, or when you put on your favorite pair of jeans, it makes you feel really good. With my leg veins, I work in a job where I stand on my feet for several hours at a time, and I started feeling my legs were heavy. And in the evenings, then it kind of progressed to where in the evenings when I got home, they hurt. It was almost like a burning sensation in the back of my calf. And we ultrasounded my legs, and of course, my veins were incompetent, and I set up the surgery. Dr. Petro is very, very caring. She's very compassionate, knowledgeable. She excels at the vein work. The surgery was simple. I went home, I relaxed that evening. The next day I got up and I got out, walked around, did my errands, did everything I needed to do, went back to work the day after that. And my leg felt totally different. It was not heavy. After about a week or two, I felt there was no pain. They weren't heavy. It felt like it belonged to me again, that it wasn't weighted down. I'm a runner, so having them light and feeling like they're my normal legs again, and not heavy when I run after work or something, feels really good.
I do work for a medical company. We sell and service imaging equipment. And so I am out in the public. I do some traveling. So it is very important to me, that I feel like I can look my best. Okay, after the Botox, and Dr. Petro, we had consulted that day, and I had told her my concerns with the just tiredness more in the my lower face area, and especially the neck area. And we discussed, what treatment that she felt would work the best, in which I truly, fully agreed with her. And that was actually a lower lift where they did a incision in the front part of ear, the front and the back. And I was just amazed with the results. But on the other hand, it wasn't so dramatic that someone could look at me and say, oh, you've had a facelift. But the results were even more than I even expected. So I was extremely happy with the results of the facelift. The facility here is very calming, it's relaxing, it's bright, it's cheery. Everybody, after your first visit, you know them by name. The surgery is actually done here on site. I live close by enough that I could go home and just come back the next day. Everything is just so well put together. You feel very comfortable. You feel like it's a professional, clean environment. As far as any facilities that I've been in, it ranks at the top with any of the other ones. I actually had a consultation with a surgeon here in Birmingham, probably a year or year and a half prior to meeting Dr. Petro, and he came very highly recommended, but I just did not have that comfort level to move forward with the procedures. And so when I did meet Dr. Petro, and basically, almost after the first visit, I had already was convinced this is who I wanted to use and felt absolutely comfortable, you know, with her. As a female, she absolutely knows what us women go through, and I think she can understand when we're talking to her, you know, more about, you know, what we want. But I would say not just for a female, I would say a male as well, you know. I think actually it would be an advantage, you know, for the male too. I think the one thing about Dr. Petro or Petro Cosmetics that stands out for me is that Dr. Petro wants you, me, to be happy, but most of all, she wants to be happy. She's going to be happy with the results, even more particular than you are, and so that is very impressive to me. And her staff, you could not ask for a better group of people to work with. I was interested in smoothing some of the lines in the lower face and the neck area were my biggest concerns. I had the Botox and it was great. I was very, very happy with it, with the length of time that it held up. I mean, it was just great. It is not about having a procedure done to impress others. It is more about yourself. And, you know, especially this day and time when, you know, us women in our 50s, you know, we're still very active in life and working every day, and you know, anything that we can do to make ourselves feel better. The smooth shapes is for the dreaded, hated cellulite that most women get, not all, some of them are very lucky, but it works incredible. It just helps smooth out some of the, you know, the ripples, I would say, you know, in the skin. I absolutely would recommend Dr. Petro for, you know, any cosmetic procedure. I mean, my friend, I have had actually 2 that's had breast augmentations and 1 that's had lipo, and the results, they are just tickled to death.